There we go.
Okay. I'm going live just now.
Okay.
Dr. Babu, you're welcome to start.
Good afternoon, ladies and gentlemen, and welcome to the South African Dental Association webinar in conjunction with the Oral Hygiene Association of South Africa. The South African Dental Association, or SADA, represents the majority of active dentists in the private and public centers in South Africa. The association is regarded as the voice of dentistry in Southern Africa and is the most relied on body regarding all aspects of dental practice in the region, both in the public and the private sectors in South Africa. The association represents the interests of both the oral health profession and its members in South Africa. OHASA, or the Oral Hygiene Association of South Africa, is a dedicated, dynamic professional association representing oral hygienists as invaluable members of the health profession team. OHASA aims to promote quality oral health care by representing, protecting, and advancing the profession in partnership with stakeholders. The main reason for today's webinar is Oral Hygienists Week, celebrated annually from April 4th to the 10th. This week is aimed at focusing on the importance of maintaining good oral hygiene practices and helping South Africans understand the role and importance of the oral hygiene profession. The week's theme, Oral Health for Total Health, reminds us all that taking care of our mouth, teeth, and gums positively impacts on other aspects of our lives. So our speaker today is Ms. Dirna Grobbelaar, an oral hygienist in independent practice at Intercare Tiger Valley since 2004. Ms. Grobbelaar specializes in teeth whitening, periodontal maintenance, and orthodontics. Her background and qualifications include a degree in oral hygiene obtained from the University of Stellenbosch, as well as an expanded function course obtained in 2001. She acts as an oral health advisor for Ivodent since 2012, promoting oral health through radio, magazine articles, and social media. With that, I will hand over to our esteemed speaker today, Ms. Grobbelaar, to begin her presentation.
Thank you so much. Oh my word, it's so lovely to be here today and being able to share some information with you regarding oral hygiene. I must say I am a very passionate oral hygienist. I love what I do. My father is a retired dentist, so I was born into dentistry, if you can say it that way. And I really absolutely love what I do. I'm going to start sharing my screen with you. There we go. So I've got a few slides prepared. And I got the topic, healthy mouth, healthy life. So very often when we think about our teeth, we really don't connect our mouth and our teeth with our whole body. But you really cannot disconnect the two. Everything starts in the mouth. And here's a few slides today that I will share with you, where I will discuss a little bit the link between oral health and your general health. I absolutely love this little slide because, you know, why is it important to take good care of your teeth and gums? And as you can see, all these beautiful celebrities, what we will look like without our teeth. So teeth is not only, of course, needs to be looked after for cosmetic reasons. There are many other reasons as well that we'll discuss today. But as you can see, our teeth really play such an important role in our everyday life. So I would say, number one, If you think of decay, in other words, decay is if you get like a cavity or a hole in your tooth, decay and periodontitis. Periodontitis is quite a serious gum disease. It's an infection that's not only in the gums, but it's spread around the tooth to the surrounding ligaments and the bone. So decay and periodontitis damage is not reversible. So if you can think of, really anything in life, once it's damaged and it's fixed, it's very seldom as hard as it was in its original state. So to me, it's always important to try and keep your teeth and gums as healthy as possible so that you don't need to do a lot of work on that. Second, a confident smile is priceless. Imagine you have to go to a job interview maybe, or meet new people. It's absolutely loving going with like a nice, beautiful smile, healthy looking teeth. It's really a confidence booster. I see many patients that come in, sometimes maybe just with a bit of staining on their teeth and so on. And when they talk to you and smile, they hold their hand in front of their face like this. And that's really so sad to me. So beautiful smile, healthy teeth gives you a lot of confidence. Number 3, you will enjoy your food. If you don't have teeth or even missing teeth, it makes it very difficult to eat and chew a lot of different types of food. It also puts a lot of strain on your digestive system. So it's very important to have teeth to be able to chew your food, to get the good nutrition from your food. Number 4, you will protect your cardiovascular system. And 5, decrease your chances of future dementia. So these are only 2 little things here that I've mentioned that you might say, oh my word, how is your mouth and your heart and your brain and things like that connected? So those are only 2 systemic diseases, but there are many other. If you think of diabetes, prem underweight babies, those are all things that get linked to gum disease. And that's why the topic today really, I try to connect your oral health to your overall health by making sure that your gums and teeth stay healthy. Again, like I said, you ensure optimum overall health. So how can an oral hygienist help? Where do we fit into all of this? First of all, we can help to remove soft and hard plaque. So a lot of patients ask me, but Dirna, what is tartar or calculus, all of those things? When plaques start to build up on your teeth, it starts off as a very like a thinnish layer. When you go with your tongue around your teeth, it feels like a little bit furry almost. And that is our plaque, or you can also call it a type of biofilm. And that can quite easily be removed by brushing thoroughly and cleaning in between. But if that buildup gets left undisrupted, it will harden and calcify, and it will then form calculus and tartar. And that is not removable really at home anymore. You have to have it removed professionally. So on these little pics here, you can see the bottom teeth been cleaned very nicely, but the top teeth is full of stains and there's plaque buildup, hard and soft. And you'll also notice that the gum line is quite red. That redness is what we call gingivitis. Your gingiva is your gum, and itis means infection. So gingivitis is the infection of your gum. And that is caused by the plaque buildup that's accumulated there on the teeth, like you can see. So I would say one of the most important things then is when you go to the hygienist, we are able to remove all of those type of buildup for you. Secondly, removal of stains, and I've put there whitening as well. So you get two types of stains. You get stains that's stuck on the outside of the teeth, and then you get the tooth color itself. Oral hygienists are able to help you with both of those. When we do a normal cleaning, we are able to remove the stains that's stuck on the outside of the tooth surface as well. And then if you're still unhappy with your tooth color, we can help you with some professional teeth whitening as well. Next is to help you with your home care and give you home care tips. For me, I would say this is one of the most important things that an oral hygienist can help you with. I know it sounds very simple, but even if you go for a cleaning on a very regular basis, but the oral hygiene at home is not what it should be, you undo a lot of the good work that's been done in the dental practice. You have to remove the plaque daily. So that's where we come in. Nobody's got the same teeth, the same mouth, the same bacteria. Some patients might struggle with crowding. Some patients just build up plaque quickly, or they struggle with stains or even sensitivity. And that is where we can help you. We can optimize your home care. We can suggest different products to use, for instance, flossing. I've got a lot of patients that come and say, Dirna, I hate to floss. Don't tell me to floss, I'm not going to do it. But there are so many other options out there. You'll see here right at the bottom, I've put these tiny little brushes. They look like small little bottle brushes. They are amazing for cleaning in between. They're quick, fast to use. You get a little rubber picks that you can use. You get water irrigators, electric toothbrushes. There are really a lot of other options out there. So we can help you with that. Make sure you use the correct size brush, the correct hardness of bristles, and maybe just give you options to make it a little bit easier for you, but to help you to do optimum oral care at home. And then number 4, treat sensitive teeth and fluoride treatments. So sensitive teeth is becoming quite a bit of a problem. I think there's a lot of different products out there these days that can be quite abrasive, that can cause sensitivity, but also a lot of us tend to overdo the brush a little bit. I call them the scrubbers. They go crazy with the brush, and that will make your gums recede a little bit, and the roots will get exposed, and those can be very sensitive. So we can help you. There's different types of treatments that you can use to help and sort the sensitivity out for you, and also look at the cause of the sensitivity. And then our fluoride treatments. So fluoride is something that can help to harden the tooth surface to help reduce your chances of cavities. We don't want to apply fluoride for everybody, but in certain cases, when it's necessary, we'll definitely suggest and apply the fluoride. And then number 5, you'll see here I've got to put a nice little pic there for you. These are called fissure sealants. I absolutely love them. What they are is these little grooves on top of your teeth, which we call fissures, are sometimes extremely difficult to reach with the brush. All the bacteria, the plaque, the food goes in there. And I would say it's one of the places on your teeth that you're probably most likely going to get a cavity. So when you come in, we can clean those out, and you'll see on the one on the right-hand side, we've put this white, flowable, thin layer of filling material in there. A lot of them these days has actually got fluoride in there that gets released into the tooth over a long period of time, very slowly, and this can help reduce your chances of what we say occlusal caries, decay on top of the tooth, with up to 90%. So that we can do for you. And then there are obviously things like mouth guards for playing rugby, bite plates, plates to sleep with, and so forth. So there are really a lot of things there that the hygienist can help you with. So what happens during an oral hygiene appointment? First of all, when you come in, we will have a look at your gums, teeth. We'll check the gums, the tongue, the cheeks, palate, all the soft tissue, make sure everything looks good, normal. We'll check for any bleeding. I like to use something that we call a perio probe. It's a thin little probe that's measured in millimeters, and I will actually measure the amount of gum that is loose from the tooth. We want this to be less than 3 millimeters. If it is, then we know your mouth is healthy. If there's areas that's deeper than 3 millimeters, when we do the cleaning, I know that those are the areas that we need to concentrate on and make sure that we get them clean so that the gum can grow onto the tooth again. In my practice, I apply a plaque indicator for every single patient. This will highlight everything that needs to come off your teeth. In this specific pic here, you'll see that there's like a purple and a pink color to it. So the pink color is a newer plaque, younger than 4 days, and the purple is older plaque. So this will help me when I give oral hygiene instructions. You will be able to see where the plaque is that you may be leaving behind when brushing and cleaning in between. But it also helped me to guide me that when I do the cleaning, I'm 100% sure that I actually removed all of the plaque. Help you with oral care instructions. So as I said, the plaque indicator makes this a lot easier because you can actually now see what I'm talking about. So if there's a lot of buildup, maybe in between the teeth, dark purple areas, and I demonstrate maybe flossing to you or using those little interdental brushes, you will be able to see the purple on the brush or on the floss, and you will see the clean tooth surface. And then just customizing it for every single patient and making it simple. It shouldn't be difficult. Then we remove that biofilm or soft plaque that we've mentioned. There are basically 2 ways of doing this. We can either do it with a handpiece and a rubber cup and a paste. In my practice, I do the one on the left-hand side, which is called air flowing, where we use a powder, very, very fine, 14 microns of erythritol powder, and water and air pressure to remove the buildup and the stains. I prefer that because it's almost, I explain to the patients, it's always like spraying your car down with a high pressure hose. You can really get in everywhere. With that powder, that's so fun. I can even go in under the gum line. It's not sore, it's not sensitive. It's really super comfortable. The machine also heats up the water to body temperature, so it helps a lot in patients that suffer with sensitivity. Then that hard buildup we spoke about, so that's the plaque that was undisrupted and that's maybe calcified. We use an electric scaler for that. What happens, the tip vibrates, and that vibrating movement makes the crystals that tartar exists of move. And then, as you can see there at the bottom left, it literally comes off the teeth. In the practice, we try these days to mostly use the electric scaler. It's quick, it's fast. If you use it correctly and you've got a good quality scaler with good points, it should be fairly painless as well. And then the last step will be to discuss with the patient when you would like to see them again. It is ideal if you've got a healthy mouth and fairly good oral hygiene at home to go and see the hygienist at least every 6 months. And this will also make the appointments very easy because the build-up's not so hard. There's not a lot. So it comes off easily. It's quick. It's comfortable. If you stay away for 10 and 20 years, it makes it very difficult because then there's so much build-up and it's so hard. And it's a lot more time consuming to take all of that off. So I will definitely advise at least every 6 months. If you tend to suffer with gum disease and things like that, or even if you just suffer with plaque that builds up very quickly, maybe every 2 to 3 months will be a better option for you. then remember, bleeding gums are never normal. Very often I get patients saying, oh, but my gums bleed. They shouldn't bleed. Healthy gums will never bleed. If your gums bleed, it's literally your body telling you something's wrong, something is irritating you. So go to your dentist, go to your oral hygienist and find out what is the cause of the gums that bleed. Most of the time it is plaque and tartar that's accumulated on your teeth, irritating the gum, and now your body is sending more blood to that area, and then when you floss or clean, it will bleed. So just know that it's not normal and try to have it sorted out as quickly as possible. Customized home care is very important. Ask your hygienist, what are my options? What will be good products for me to use at home to make my life easier, but to be effective as well. I would say in my practice, I love an electric toothbrush. Some of those toothbrushes has got 60 to 80,000 movements per minute. It is really impossible to do that by hand. I think your arm will fall off if you try to do that. So go and have a look at electric toothbrushes. I also advise maybe opt for a better quality one, even if the beginning you share the brush, because remember you can have one handle, but you can have different electric toothbrush heads that you put on the same handle. So for instance, all the children can use the one handle, but they each just have their separate little head that they can use. Those toothbrushes have also got timers on them that will guide you. And let me tell you, I don't think a lot of us actually brush for 2 minutes. That is the recommended time. If you're in a hurry in the morning, I tell you 2 minutes can be pretty long. So customized home care is important. And then healthy mouth, healthy life. Thank you very much.
Thank you so much, Dirna, for that wonderful.
It's only my pleasure.
It's such a wonderful presentation, and I'm really sure that it's going to be invaluable to the members of the public. I'm wondering if we have any questions from the audience. I do believe we have some viewers in the audience. No questions? Okay. All right. If we don't have any questions, then I'm going to just close off the session. So thank you everyone so much for watching. And again, thank you, Dirna, for taking your time out to present this wonderful webinar for us. And have a lovely afternoon further.
Thank you. Absolute pleasure.
Thank you.
Thank you.